So in this study, we focused on how cardiovascular risk factors ascertained by the life essential 8, which is a sort of novel. It has been over around 2 years, public and research health construct devised by the American Heart Association that basically encompasses the 8 most important pillars of cardiovascular health, and always done from a preventive point of view, right? So we're understanding blood pressure not as if you do or you don't have hypertension, but basically your numbers of systolic blood pressure and diastolic blood pressure. The same with blood glucose, not if you have or if you don't have diabetes, but of course your levels of blood glucose and so on and so forth. And we wanted to understand because we have been lately in science, we have been seeing that cardiovascular health is very strongly linked with poor brain health later in life. So we wanted to understand how this is, of course, in a timely cohort of 5 years, which was a follow-up. And of course, we wanted to use a patient-centered and comprehensive composite that really encompasses the most important diseases related to poor brain health, which we focused on stroke, we focused on dementia, and late life depression. And for this, we designed a prospective cohort study using a discovery phase and a replication phase. In our discovery phase, we focused on data from the UK Biobank, and in our replication phase, we focused on data from the All of Us research program. So the UK Biobank is known by many out there. It's an incredible and massive study being done in the UK. They have enrolled approximately 500,000 participants and have all sorts and types of data about them. It's actually an amazing study. And on the other hand, we have the All of Us research program, which is a very, very similar study being now performed in the United States, endorsed by the National Institutes of Health, with a very similar narrative, right? A prospective study done within the United States, of course, volunteer-based, but trying to reduce the known disparities that exist in science and that affect mostly minorities in research. So for that reason, they aim to enroll 1 million Americans and, of course, try to reduce these disparities that have been affecting science as a whole. So we designed this prospective cohort study with our both stages. We focused on our exposure, of course, the life essential 8 score, which we divided into categories of optimal, intermediate, and poor. And after following our participants for a lapse of 5 years, we indeed found in our results that having intermediate or poor cardiovascular health, right, as ascertained by the life essential 8, and when being compared to optimal, would indeed correlate with higher and higher rates and risk of this composite of the most important diseases related to poor brain health.